What happens when you get a heart attack? See, that's a good question. That's a very good question. Do you know why? Because that happened with this patient. Alright? What happens is I not only do the x-ray side of it, but I monitor the patient's heart when everything's going on. So I do all the physiological monitoring, that's what it's called. So I have to watch their heart rate and their blood pressure. Alright? If anything starts to go wrong with that heart rate or blood pressure, I have to let him know, because he's busy looking at this, doing this. Alright? He's not always looking at the monitor where it has my aortic pressure and the heart rates.
You're the number cruncher.
Yeah. So when we were fiddling around, okay, and we were trying to put this wire in, he shifted a plaque at the start. And because it was already so very tight, that plaque shut off the rest of the artery. Okay? So what happens to my blood pressure and my heart rate? What do you think happened to it?
It dropped.
That's right. Suddenly my heart rate, which is normally approximately 60 beats a minute, okay, in a normal person, that started to go really slow. That's called brachycardia, okay, where everything slows down. And suddenly my heart rate, okay, my blood pressure.
You actually mean the blood pressure of the patient.
The blood pressure of the patient, not my blood pressure. Yeah, my blood pressure's going up.
Yeah.
His blood pressure's going down. And it suddenly starts to, like, a tracing is very sharp peaks. But when it starts to go down, it slows down and they're further apart and it drops right down. Okay? And I don't like that happening. None of us do. So we have to react very quickly. We have to give the patient drugs which will suddenly speed up the heart rate and which will bring that blood pressure back up. We push in fluids really quickly into the patient. When you put in a lot of fluids quickly, it forces up your blood pressure. Okay? When you give your patient atropine, atropine speeds up the heart, makes it work faster. There's a delayed reaction, so we have to give it in increments. We have to give it and then wait a minute. We give another drug called aramine. Aramine also speeds up the heart.
So you were doing this to him because he was having a heart attack at the time while you were doing the...
Because we'd blocked off the artery.
Wow.
So in the meantime, we have our anaesthetic tech given that. I'm recording everything that goes on. We have a MET team that we call. If he crashes, we have to call the MET team. Okay, and there's a
when you
special
say crash,
response.
That means he goes into cardiac arrest.
So we go into VT or we go into VF, okay, which is an arrest. But we try to prevent getting to that point in time. So in the meantime, the doctor is frantically trying to get the wire back in because he knows that that's the main thing he needs to do. Once he's got the wire across the lesion and he can get a balloon in there quick enough, he can reopen the artery and it's all fixed, which is what happened. So it was a very good outcome and everything went to plan. Which is what happens when messing around with people's hearts. Okay? You have to expect this. We have a defib machine always in our lab. It's checked every morning. All of our drugs must be checked. Everything is ready. So you're always prepared for the event of something happening. It might not happen today. It might be in 300 cases' time, but you must always be ready.
Can I ask how often that could happen, or something that's you don't wish for, like an unexpected thing? Does that happen on a daily basis, or would it happen rarely?
It is normally rarely, but this doctor does do a lot of high-risk procedures.
So it depends on the patients, doesn't it?
The patients, the risk of the procedure increases the odds.
Does it hurt getting the wire?
No, because before they make